Medicine has been pushing the quality of healthcare forward for decades. Innovations in the field are often the evolution of existing products. Seldom are products created fresh, with the user and patient outcome in mind. Rarely is a holistic look taken at making the work of the medical professionals more efficient, productive, and ultimately providing the best healthcare. Pioneering new ideas requires professional input, creative thought, and a vision to what could be. The ZIPLift IV transfer system from Innovative Medical Designs is one such product that takes all of these considerations into account: efficiency, productivity, and patient and staff care. The ZIPLift transfer system works like a normal IV pole, but it also enables nurses to transfer IV poles to and from the patient's bed without lifting or detaching pumps. This improves nurse safety by reducing lifting and back strain. Patient safety and comfort improves with better organization of IV lines and cords. Since the system can be used anywhere in the hospital, the result is a safer, easier, and faster patient transport. The ZIPLift stand raises and lowers to effortlessly detach the IV transfer pole to and from the bed, separating the IV transfer pole from the ZIPLift stand. The ZIPLift system eliminates reorganizing lines, tipping stands, narrow doorway transitions, and lengthen elevators while securely connected within the bed footprint. The ZIPLift system can be used on all patient beds throughout the entire hospital for the entire patient stay. This enables your staff to be freed from the task of searching for equipment. The ZIPLift system maintains a constant relationship of IV pumps, lines, and bags to the patient, thus eliminating the risk of separation. The ZIPLift system securely attaches the IV transfer pole to all standard IV sockets, eliminating casters on the floor. Two unique elements make the entire ZIPLift IV transfer system work. It seems simple, but the two unique ZIPLift system elements are able to accomplish so much. The first element of the ZIPLift IV transfer system is the IV transfer pole. The pole is designed to attach to both the patient bed and a rolling stand. The pole is telescoping and is capable of carrying up to 3 multi-channel pumps. The second element is the ZIPLift stand. This is a self-contained lifting stand, vertically lifts and connects the IV transfer pole to and from the bed. The greatest thing about the ZIPLift IV transfer system is that it is so intuitive. Let's begin by watching how to attach the IV transfer pole to a patient bed. When preparing to transport the patient, the nurse grasps the handles, rolls the ZIPLift stand to the corner, and positions the yellow receiver pin over the IV socket. Using the foot brake to hold the stand in position, the nurse presses the ZIPLift stand lever, lowering the IV transfer pole into the IV socket. In the event that the yellow IV transfer pole does not completely seat within the bed's IV socket, do not be alarmed. Simply grasp the pole and allow it to seat within the socket. Roll the ZIPLift stand to the side, and the patient is ready for transport. If the ZIPLift stand is needed during transport, just place it onto the existing IV sockets in the bed. In order to place the IV transfer pole back onto the ZIPLift stand, the process is just as simple. In order to remove the IV transfer pole from the bed, simply grasp the handles, align the ZIPLift stand black receiver pin, brake, and release. Once engaged, continue raising until the IV transfer pole is released from the bed. In the event that the orange receiver block does not completely seat within the ZIPLift stand recessed pocket, do not be alarmed. Simply grasp the pole and rotate until seated on stand. The ZIPLift IV transfer system benefits to your organization are as follows. IV poles and pumps are transferred without ever being detached or lifted by the staff. Pumps remain secure during transport. Transporting through doorways and hallways is simplified. Access to patient head and airway is always unobstructed. Medical staff and patient risk is significantly reduced. Time commitment is greatly reduced. No more tangled lines. Also, the ZIPLift system allows mobile patients to be safer and more comfortable. The ZIPLift system stand has a centered weight distribution that prevents slipping and rolls easier than traditional small, caster-fitted IV poles. The standard cord wraps and 4-hook topper are designed with the healthcare profession in mind. Additional options are available to specialize your care. The BOA line organizer keeps lines separated off the floor and orderly. 8-hook bar spaces out IV bags to maintain organization. The ZIPLift IV transfer system has immediate benefits for the nursing staff, human resources, and risk management. Tasks that used to require 2 nurses now can be done with 1, saving labor. Functionally innovative products attract and retain better nurses. The system benefits nurses by reducing back injuries. This fresh design approach provides so many benefits with the ease of use, accessories available, and simple setup. You are just 2 boxes and 1 bolt away from experiencing the ZIPLift IV transfer system. Once again, Innovative Medical Designs is raising the standard with the innovative ZIPLift IV transfer system. Visit us at imdusa.net for additional product and contact information. Request further information and we will be talking to you soon.